For this PLAB2 scenario, you have to deconstruct the question and understand your task. Jonathan is a 42-year-old man who was involved in a motor vehicle collision yesterday. He has come to A&E with neck pain. So that's your scenario. Doesn't mention much apart from the injury and pain. Take relevant history from the patient, do a focus examination, and discuss management with the examiner. Now, OSCE have to have a focused approach. You need to decide what few questions you will ask from this patient and not spend the whole session in history taking. You have to move on to your second task, which is a focused examination of the patient and discuss the management. So, to deconstruct the question, your history will involve what happened and what are the consequences. You can of course ask about past medical history and other relevant bits in short. Now, focus examination would include local examination and the consequences of injury, which may be neurological. And you will discuss with the examiner the investigations you will do, the explanation you will give to the patient, and treatment and advice. Let us look at some answers. Of course, you will first do your greets, consent, explanation, and so on. In history, some appropriate questions would be asking about how this happened, who was driving, was the patient wearing a seat belt, what speed was the car in, what type of collision was it, means head on head or back to back. After that, you can ask about who else was in the car. Now coming to patient symptoms, about pain, where is it, since when, what type, is it radiating. You can ask, has there been a head injury? And then signs of raised intracranial pressure, headache and vomiting. Then move on to ask whether he has suffered any consequences, any neurological symptoms like tingling in arms, numbness, weakness, bowel bladder problems. Finally, you can ask about a little bit about, have there been any previous neck problems, or does the patient have any other underlying medical problems? That covers most of the relevant history questions. Moving on to examination. You will first go behind the patient, advise them that you will be touching their neck. Inspect the neck first. Is there any swelling, bruise or deformity? There shouldn't be. Then palpate the neck. First palpate on the spinous process and then the paraspinal muscles. Is there any tenderness? Ask the patient as you do so and be gentle with them. You then have to do a brief neurological examination that will include mainly the arms, because cervical spine carries nerves for the arms. So check sensations for touch and pain, check power in the fist, wrist, elbows and shoulder, and check the biceps and triceps reflexes, and then make the patient walk and see their gait, or at least recommend that you will be wanting to check the gait. Examiner may ask not to do so. So that covers your focused examination. Now, explaining and investigating. You would have initially told the patient not to move the neck because this is a suspicious injury. Now, first you suggest to the examiner that you will put a neck collar, get an X-ray done. If the X-ray is normal, then you will remove the collar. Then you would examine the neck movements and then explain the patient that if there are no significant examination findings, that this is a soft tissue injury and there is no serious injury to the spinal cord or nerves. Explain this is called whiplash injury. Patient may experience pain and spasms for the next 2 to 3 weeks, so they will need pain relief. Sometimes muscle relaxant medications are also necessary. Encourage neck exercises once the pain has settled in a few days. Recommend that you will make a physiotherapy referral. Explain that neck collars are not necessary because they will weaken the muscles. And tell patients that because they are not able to turn their neck, they will not be able to drive for 2 to 4 weeks.